All right. Well, good morning, everybody. Thank you for coming and welcome to ALS United Connecticut's Ask the Expert series. We are thankful to have Jackie Wolski attend and present today. She is the registered dietitian and nutritionist at the Hospital for Special Care, the Certified Center of Excellence in New Britain, Connecticut. And she will be presenting on the topic of nutrition and ALS. So I will send it over to Jackie. Thank you again for your time and for being here.
Okay, thank you. Thank you for asking me to talk. I'm honored to be your presenter today. So I'll get started. Let's see if I can share my screen. Okay, does that seem to be working?
Yes.
Okay. See how I advance it. Okay. Okay, here we go. So I'll be talking about the challenges of nutrition with ALS. I don't have any disclaimers. The objectives are to go over the role of the dietitian in the multidisciplinary clinic, review the role of good nutrition and weight maintenance in ALS, the importance of it, identify the nutrition challenges, and then provide some recommendations to deal with those challenges. I'll also go over when to consider a feeding tube along with the pros and cons. And I'll provide you with some resources to help you optimize your nutrition through the disease process. So the role of the dietitian is to do a nutrition assessment to gain an understanding of the challenges of each patient and their families and what they're facing, and provide you tools and information to optimize your nutrition status. And part of the role is coordinating with the other team members, because nutrition is not just the role of the dietitian. It involves the occupational therapist to help with feeding difficulties, getting adaptive utensils, or recommending one-way straws or longer straws, or also the speech therapist can provide safe swallowing techniques. So we coordinate with all the disciplines to come up with a nutrition plan, and especially with the doctor to review the whole basically plan and what's going on with the patient, and particularly, the patient's wishes as far as getting a feeding tube placed. I coordinate with the social worker on maybe getting meals on wheels or help with food prep or home care needs related to eating. I'll coordinate with the respiratory therapist regarding cough assist or suction. Oops. The light went off, sorry. The cough assist or suction to deal with phlegm and excess saliva, which is one of the issues that can come up. And then non-invasive ventilation use. You wouldn't think that would be nutrition related, but as breathing gets more difficult or breathing function declines, you're burning more calories with the work of breathing. So when you start using non-invasive ventilation, it decreases your calorie needs. So knowing how many hours you're using the non-invasive ventilation can help me determine your calorie needs. And then coordinating with the nurse who it helps me deal with if there's tube feed complications of the actual feeding tube. That's her expertise. Medications for constipation, we kind of coordinate the plan for constipation, and same with urination, condom caps. If getting up to go to the bathroom is an issue and patients limit their fluid because of that, then we look at other ways to manage that other than limiting fluid, because we don't want you to limit fluid because it can cause constipation and lead to other issues. So we'll start with the importance of good nutrition. So, everybody, not just ALS patients, needs good nutrition to stay well nourished. You need the right balance of carbohydrate, protein, fats, vitamin, minerals, fluid, and fiber, and other nutrients to promote optimal body weight. And we'll talk a little bit about what optimal body weight is for the ALS patients a little bit. It's fuel for your body and your brain functions, to maintain muscle mass, to support immune system, ward off chronic diseases, stay well hydrated, and to overall feel your best. So healthy eating, this is kind of a picture of what healthy eating can look like. Basically, get a variety of foods so that include all your food groups so that you get all the different nutrients that are provided by the different food groups. And then within each food group, it's important to eat a variety, like for vegetables, it's important to eat a variety of different colors of vegetables because they have different vitamins and minerals. So basically, a varied diet is important. And this goes over like the recommended number of servings from each food group to eat a healthy, well-balanced diet. So look for your meat, your protein, eggs and beans and nuts group, 2 to 3 ounces, 2 to 3 ounce serving, 2 to 3 servings a day. The range in servings depends on if you're a small person or a large person. If you're a small person, the smaller, the less servings you need. If you're a larger person, you would eat the larger number of servings. 6 to 11 servings of your starchy foods. These can add up quickly. 11 servings sounds like a lot, but a half a cup of pasta is not, a full meal. So if you eat 2 cups of pasta, that's 4 servings right there. Your milk group is important for calcium, vitamin D. It also has protein. So a cup is a serving or an ounce of cheese. Getting 2 to 3 servings a day is what's recommended. Oops, I go backwards. Sorry, I touched a button I wasn't supposed to. Let me go back. Let's see. There we go. Fruits, excuse me, 2 to 4 servings of fruits, and that's about a half a cup of cut or a cup or a piece of whole fruit like an apple or an orange. And it varies, by fruit, like 15 to 17 grapes is a serving of grapes. And then your vegetables would be half a cup of raw vegetables would be a serving, or a cup of, or half a cup cooked, 1 cup raw, 3 to 5 servings a day. And then limit your fats, oils, and sweets in moderation. But we'll kind of modify that. If you're looking to get extra calories to prevent weight loss, that's where you can get the extra calories by adding fats and oils and sweets, because your fats are definitely more calorie dense than carbohydrates or protein. This is another way to kind of look at a healthy meal is, about a quarter of your plate be fruits, vegetables, protein, and grains, and then have a serving of dairy with that. So let's start with the challenges, nutrition challenges with ALS. So obviously chewing and swallowing can become difficult, fatigue with eating, shortness of breath with eating, feeling full, or early satiety, feeling full quickly, decreased appetite, arm weakness, making feeding yourself difficult, increased time to finish a meal, whether it's because you're chewing more, because it's harder to feed yourself and it's taking longer, and increased calorie needs. So your calorie needs increase with disease progression. As I mentioned before, as the breathing function declines, your body's working harder to breathe, so you're burning more calories. As you're feeding yourself for an hour sometimes, as opposed to a 15-minute meal. So that's more calories. So calorie needs increase with disease progression. So all these things are challenges. We'll go over each of them and come up with some suggestions for you. Other potential challenges are excess saliva. It's not like you're producing extra saliva, but when your swallowing becomes difficult, you're not swallowing as much, and then that could lead to the perception of excess saliva. Well, it is excess because it leads to drooling, and you're not able to manage that saliva. Phlegm or thick phlegm and not being able to bring that up can be an issue. Oh, there goes my light again, sorry. Sometimes dry mouth is an issue with the non-invasive ventilation, or some of the medications that take care of the excess saliva can cause dry mouth, and then that makes eating a little more difficult. Constipation can be an issue, and dehydration, those go hand in hand. Fluid tends to be limited by ALS patients, for a variety of reasons, whether it's water might be one of the first things that you find that's difficult to swallow, or you cough with liquids because a drop of water goes down before you initiate the swallow, and it goes down the wrong way, so you cough. So people will limit their fluid intake because it gets more difficult, or if they have issues with needing help to go to the bathroom, they might limit their fluids at certain times of the day when they know they don't have help. So limiting fluid can lead to dehydration and constipation. So inadequate calories and protein can lead to muscle loss and weight loss, which can lead to malnutrition. We want to avoid, excess or unnecessary muscle loss. Part of the disease process is muscle wasting. So you will be losing some muscle, but you don't want to lose muscle unnecessarily. You want to maintain your muscle mass as long as possible to feel well as long as possible. So the importance of weight maintenance and avoiding malnutrition is that malnutrition in studies have shown to be a prognostic factor for survival in patients with ALS. So basically, the study showed that those patients with a higher BMI, body mass index, and I'll go over body mass index a little bit later, but basically that's an indicator whether you're overweight or underweight. BMIs of 30 to 35 are considered obese, but the patients in that body range or weight range tend to have a longer survival. And other studies have shown that those with a BMI of less than 18.5, which is underweight, has a shorter survival. And here's the BMI chart. So, like I said, BMI from 30 to 35 in this range is where patients tend to have the greatest survival. If you're in the normal or overweight category, you have kind of a normal survival, and then a better survival if you're overweight to start, and then underweight, less survival or shorter survival. So the importance of weight maintenance. Eating can become difficult as the disease progresses, like I mentioned. And malnutrition accelerates muscle loss and has a negative impact on the immune system, the respiratory system, quality of life. So you want to avoid, unnecessary muscle loss. You might notice that you're losing muscle in your arms and legs, with disease progression, but you notice that you're gaining weight around your abdomen. That doesn't mean that you're gaining weight necessarily, because it's very common that you gain abdominal girth, even though you're losing weight. And that's because the abdominal muscles get weaker too and don't hold things in as well. So it's important to, if you notice that you need a larger pair of pants because your abdominal girth is increasing, it's important not to try to lose weight. So your goal is to maintain your usual weight, even if you're overweight. If you're morbidly obese, like BMI over 35, and desire to lose weight, you can lose weight slowly, but we don't want you to lose weight quickly, because that could lead to unnecessary muscle loss. If you're underweight, the goal is to gain weight. And the dietitian can calculate your specific calorie needs and protein needs, but your calorie needs change throughout the disease progression, and with non-invasive ventilation use, like I mentioned before. So in general, as your body's working harder to, do things like walk and feed yourself and breathe, as those functions decline, your calorie needs increase. So even though I can calculate how many calories you need, it's a moving target. So I'll usually, if you're losing weight with the number of calories or the amount of food you're eating, the goal would be to increase by, 200 or 500 calories a day. So I do that more than calculating your total calories, but kind of give you an idea how much more you have to eat to prevent that weight loss. And then again, that can change as disease progresses. And then if possible, monitor your weight at home. Some people are surprised when they come in and they don't think they've lost any weight, and they're surprised that they've lost 10 pounds. Sometimes it's not possible to monitor your weight at home because you can't stand or you're in a wheelchair. But if you can still, monitor your weight at home, that is suggested to do, so you can kind of keep an eye on things. All right, so ways to increase your calorie and protein intake. Like I mentioned before, fats have more calories than carbohydrates or protein. So a good way to add extra calories is to make your foods more calorie dense by adding extra oil, butter, margarine, mayonnaise, cream, gravy, cheese sauces, even sugar to your foods. One easy way to get in extra calories is to drink beverages with calories instead of water. I know water is a good thing, and normally we recommend drinking plenty of water. But if you can drink something with calories, that's helpful. And then avoid, low fat and sugar-free products. Go for the full calorie products. Another easy way to get in extra calories is add powdered milk. You can add powdered milk to your milk. You can add it to other recipes. You can add it to anything like your oatmeal, anything that's kind of pureed consistency. If you're making smoothies, you can add, that's kind of like a protein powder, an inexpensive protein powder. And, like things like oatmeal that you might make with water, you can make with whole milk and add some brown sugar, some butter. Smoothies are an easy way to get in some extra calories. You can add some peanut butter. And it's an easy way to get in some fruits and vegetables too, if chewing fruits and vegetables gets to be difficult. And then milkshakes, but not with added ice cream and whole milk. You can use the premium ice cream, which is the higher calorie ones. And another way to get in more calories is no skipping meals. If I frequently hear patients say, I'm only always eating one meal a day, but it's hard to get in all your calories in one meal a day, especially if you have early satiety and you can't eat as much anymore. It's important to eat your 3 meals a day, and you might even need to snack in between your meals and have small frequent meals if you get full quickly. You can carry food wherever you go, so you can have snacks available, especially when you come to the appointments in the clinic. They tend to be long appointments and through mealtime, so you can bring snacks. If you get tired later in the day, which is common, try having your main meal earlier in the day when you're feeling more energetic and not as fatigued, so you can eat more. Oral supplements or protein drinks is a quick, easy way to get in extra calories. And there's a whole variety of different ones, and they're always coming out with new ones. I listed, some of the names of some common ones here. Some of them may be more appropriate than others, depending on what else is going on with you. If you have a lot of phlegm and milky type beverages, make that phlegm worse. You can try something like Ensure Clear, which is more like a juice-based supplement, so it doesn't thicken the phlegm. It's not as high in calories or protein as some of the other ones, but it's better than just drinking water. There's also, like Glucerna is for diabetics, so it's lower in sugar. Boost VHC stands for very high calorie. That has 530 calories in 8 ounces. So if you're looking to get in a lot of calories, that's, might be more appropriate for you. Some patients like more wholesome ingredients. Cape Farms is a newer product that has a little bit more wholesome ingredients. There's also Orgain, which is organic. So depending on, patient preference and your, your needs, the dietitian can recommend what's appropriate for you. A word of caution about high protein supplements. I didn't list on there, they have Ensure High Protein. There's some that have like 30 grams of protein in an 8 ounce serving. If you're, a 5 foot, 100-pound female and you're drinking 3 of those a day, that's probably too much protein for you. You don't want to stress out your kidneys by taking in excess protein. There are no studies that indicate that ALS patients need increased protein. But when I assess patients' protein needs, I estimate a little higher than the minimum. There goes my light again. Sorry, people. So I estimate, a little higher than normal, but below the maximum, so you don't stress out your kidneys. And I can, calculate that out for your individual needs. So a question that I get often, I'm diabetic, should I eat foods with sugar now? Usually if diabetics with ALS, if their blood sugars are well controlled, you can definitely incorporate sugary foods into your diet, like 4 ounces of juice mixed with 4 ounces of water. Even diabetics that don't have ALS, can incorporate some sugary foods in their diet as long as their blood sugars are well controlled. So I prefer not to limit the diet because you need the calories. Another question I get is, I have high cholesterol and avoid high fat foods and cholesterol. Should I start eating high fat foods again? So like I mentioned, fats have more calories than protein or carbohydrates. So adding fats into your diet is a helpful way to get in extra calories. You can do that by eating heart healthy fats if you're concerned about your cholesterol. And heart healthy fats would be fats from plant sources. So all your vegetable oils, and then, like avocado, it would be a heart healthy fat. Nuts and nut butters are heart healthy fats. So you can avoid, butter and saturated fats, from meats. But you can still eat lean meats. Sure. All right. So we'll go over the difficulties with chewing and swallowing. The first things that you might notice when you start having difficulty would be coughing with thin water, or difficulty chewing tough meats, or difficulty maneuvering lettuce in your mouth, or coughing with crumbly foods like crackers and nuts. Having difficulty with mixed consistency foods is also common. Like chicken noodle soup, where you have, a little tough meats, you've got liquid, you've got slippery noodles. So there's a lot going on in your mouth. So you might cough on the liquid, or the liquid might go down the wrong way. You might notice difficulty with sticky foods, like peanut butter or sandwiches with like pasty bread that, gets sticky. So there's ways around, you can use softer meats, like instead of steak, have meatloaf and meatballs. Lettuce, you can use, coarser lettuce chopped fine, or have cooked vegetables. Dried crumbly foods, you can either add moisture, dunk your cookie in coffee, or avoid the dry, crumbly foods altogether. Vegetables, you can have cooked vegetables as opposed to raw vegetables. Fruits, canned fruits might be better than fresh fruits because they're not as chewy and they slide down. So there's ways around the difficulties with chewing and swallowing. And here I list a few of those, softer foods. Meatloaf, fish, quiche, chili, mac and cheese, shepherd's pie. So these are all good choices. Other suggestions: cut up your foods very small, take small bites, and chew foods well. If you're having difficulty with thin liquids, like coughing with water, and naturally thicker liquids tend to be better tolerated because they stick together and they don't separate in your mouth. So, even sometimes just fruit juice is just that little thicker and stickier to stay together in your mouth and reduce the risk of coughing. Take smaller sips. That's a big important suggestion. Taking smaller sips. Patients will usually tolerate water or will cough with water, but don't cough with coffee because it's hot and you usually naturally take smaller sips. So taking smaller sips is very important to prevent coughing, or using a straw helps to control the sip size. And then the speech therapist can provide you with safe swallowing techniques as well to deal with the difficulty with chewing and swallowing. If eventually soft foods become too difficult, you might require blenderizing or pureeing foods. Foods that are naturally come in a pureed consistency, or you eat them in a pureed consistency, like mashed potatoes or sweet potatoes, custard, pudding, yogurt, ice cream, smoothies, applesauce, oatmeal, all those are usually more appealing than pureeing, spaghetti and meatballs or something. But you can puree almost anything once you get past the idea of eating pureed foods. And you could try baby food. Fruits and desserts and vegetables are usually tasty. Vegetables and the meats and the meals, you may have to add salt because babies don't need salt. There are also pureed, ready-to-heat meals, Thick and Easy pureed meals by Hormel Labs. You can order online. I have seen some of these available at Walmart, so you could check there. There's also cookbooks available for easier chewing and swallowing, and I list some of them here. The first one, top one, the way the book is set up is at the beginning of the book goes over tools that might be helpful in the kitchen, like a ricer, the different blenders, and then how to go about blending food, like how many ounces of meat to how many ounces of broth, or adding some thickener to vegetables because they tend to be very watery. And then the last half of the book gives recipes from soft all the way to pureed. So some people find the books helpful. You can purchase these on Amazon for $15 to $20. Another challenge with eating with ALS is fatigue or shortness of breath or early satiety, increased time to finish a meal. The things that may help with that is taking a nap before eating so you're not as tired, so you can eat a little bit more. Eat softer foods and cut them small so you don't get as tired from chewing, to basically conserve your energy. And small, more frequent meals we talked about already. Eat more nutrient dense foods. We talked about that, making things more calorie dense so you don't have to eat as much, but you're eating more calorie dense foods. You can add a supplement or milkshake between meals. Now, decreased appetite is an issue sometimes. A lot of times patients are depressed when they first get their diagnosis. They lose their appetite, but after a couple of weeks, they get their appetite back. If it's a chronic problem, sometimes it's associated with depression. If depression is treated, sometimes that resolves it. But if you have chronic decreased appetite, these are some tips that you can hopefully be helpful for you. But avoiding low-calorie foods, like I said, make things calorie-dense so that what you are eating helps you to maintain your weight. Plan to eat smaller portions at meal times and snack in between meals. Drink liquids between your meals so you don't fill up on liquids and not feel like eating, especially if the liquids are like water and not calorie dense. Season your foods to taste, eat in a pleasant, relaxing environment. Try a variety of foods, including your favorite foods, to see if that help your appetite. Make your food look attractive. Invite a friend to eat with you. If you still have a decreased appetite, you can talk to your doctor about appetite stimulants. Some people use medical marijuana to stimulate their appetite. So those are some suggestions for that. So what would be the most appropriate for a patient with ALS and fatigue and dysphagia? Eating a salad or eating mac and cheese? And you probably all know the answer by now. Would be the mac and cheese is easier to chew and swallow and higher in calories. So even though the salad is very healthy for you, if you're experiencing fatigue and increased calorie needs, the mac and cheese would probably be a better choice. Dehydration, I mentioned, can be a problem because a lot of patients end up limiting fluid intake or having difficulty with drinking liquids. They need assistance to go to the bathroom, so they limit their fluid intake. Hand weakness can contribute to dehydration if patients can't go get themselves a beverage or they're not able to hold a cup. So that can affect how much they're drinking. Signs of dehydration, increased thickness of saliva, which we talked about, the phlegm being more difficult to manage. So by drinking adequate fluid, that helps with that. If your urine volume is low or darker yellow, then that's a sign of dehydration. If you have rapid heart rate, constipation, dry mouth, increased thirst, you're really tired or sleepy, dry skin, dizziness, orthostatic hypotension, basically like if your blood pressure goes low when you stand up, or it could cause a headache. So drinking adequate fluid can make you feel better by avoiding all these symptoms of dehydration. So to improve your fluid intake, if you're having difficulty with thin liquids, try drinking naturally thicker liquids if better tolerated. There are also thickeners that you can thicken thin liquids with, and the speech therapist here usually has samples of a gel-based thickener, which usually works well. Keep a cup of your favorite beverage nearby to sip on throughout the day, and that's helpful. You may have to come up with ways to do that. If you can't pick up a cup, get a big cup that has a long straw that you can access yourself. Arrange for bathroom assistance rather than limit your fluid intake. You can talk to the clinic occupational therapist or social worker for suggestions for help with those issues about the toileting. And then gradually increase your intake of beverages towards the average range, 6 to 10 cups a day. If you're a smaller person, you might need only 6 cups a day. If you're a larger person, you could need 10 or more cups a day. So the dietitian can calculate your specific fluid needs. So constipation, this is definitely a big issue. Usually one of the major causes is inadequate fluid intake, which we just talked about. Weaken abdominal pelvic muscles, make it more difficult to push, so that can contribute to constipation. Decrease physical activity when you're no longer walking, and that can slow down gut motility. If you're having difficulty chewing fibrous foods, that can lead to a diet lower in fiber, which can affect constipation. Side effects of medication to control your saliva, or pain medications, or an iron supplement, those can all be constipating. So there's a lot of things that can cause constipation. So I always like to make sure that everybody knows how much fluid they need to be drinking. So suggestions for relief of constipation, like I said, drink adequate fluids, eat high fiber foods, which would be your whole grains, soft fruits and vegetables and beans. You could try 2 to 4 ounces of prune juice to start and increase as tolerated, or 3 to 5 prunes a day. Usually that helps to get things moving along. You could try a fiber supplement if your fiber intake is low, or over-the-counter stool softener. If pushing is difficult, using a squatty potty might be helpful, because that helps the positioning to help push things out. If you're still having difficulty, you can talk to the clinic nurse or the doctor about a laxative or a prescription to help relieve the constipation. Thickened phlegm that's difficult to manage. So again, fluid intake, adequate fluid intake helps to keep the phlegm thinner to make it more manageable. Hot beverages can be especially helpful to keep the phlegm thinner and more manageable. Pineapple or papaya juice contain an enzyme that helps to break down the protein in the phlegm, so that can be helpful. If milky products or chocolate that can coat the phlegm and make it thicker and more difficult to manage, so you can avoid those. And I know a lot of the higher calorie foods that I mentioned were milky products. So yeah, there can be a fine balance between managing the thick phlegm and getting in extra calories. You can also ask your respiratory therapist about cough assist or suction to help manage the thick phlegm if it's still a problem. Frequently asked question. Another question I'm asked often is, are there any vitamins or supplements that I should be taking that can help ALS? There's a lot of confusing information when you Google online. For many of the supplements, there's not a lot of scientific evidence to back up the claims. For some of them, there's a plausibility, but further studies are needed to confirm, the claims. But ALSuntangled.com is a website where you can find reliable information to help you determine, is it worth taking vitamin B12? There's a study that came out now on omega-3, a diet's high in omega-3 fats, which are the good fats, and they're healthy for the average person, not just ALS patients, but those have been associated with better outcomes or improved outcomes with ALS patients. And, that's healthy for everybody. So, why not try that? But again, there still needs to be other, additional studies on that. So I'll usually recommend a multivitamin to ensure that you get in adequate vitamins and minerals to avoid vitamin deficiencies, especially if you're having difficulties with chewing and swallowing and don't get enough fruits and vegetables in, because your fruits and vegetables are high in your vitamins and minerals. But I would avoid taking high doses of any one vitamin or mineral because, like, for example, taking high dose of zinc can lead to a copper deficiency. Taking high doses can lead to toxic effects. For example, your fat-soluble vitamins, vitamin A, D, E, and K, those can be stored in the body and potentially cause toxic effects. Your water-soluble vitamins are less likely to do that. And if you have questions, you can always ask me about specific supplements. So I put this slide that it's a list of reliable websites where you can find reliable nutrition information, instead of just randomly Googling and not knowing if you're on a reliable website or not. But alsnutrition.org, als.org, and then I put where you can, click on to get to the information fact sheets about nutrition, targetals.org, and then just type in your search, the search bar for nutrition, your alsguide.com, and lesturner.org/ALS, and then nutrition guide. And then I mentioned the ALS Untangled again. I'm going to go a little bit into the ALS Untangled website. So what ALS Untangled does is it's a group of doctors that review all the literature that's out there on a topic, or a vitamin or mineral, or we basically refer to them as alternative therapies. So it's not all nutrition topics, like this one, Dean Kraft Energy Healer. I don't even know what that is, but or light therapy. But the top one here, vitamin E, you can see they grade the mechanism. That means, does it, the hypothesis of why it would be helpful, does that make sense? So for vitamin E, it gets a grade of A. So it's plausible that the hypothesis on why it helps, it's plausible. So you're looking for, grades of A. You don't want D's and F's. Preclinical studies, this gets a grade of C. For vitamin E. Case studies gets a grade of A. So case study would be like somebody reported that vitamin E helped them. Trials gets a grade of F. So there's not a lot of clinical trials that have been completed where I can say, yes, this has been verified. But the risks gets a grade of A. So it may not hurt to, try the vitamin E. So, and then same with like methylcobalamin is B12. So it grades everything there. So it helps you to make a well-educated decision on whether you want to try something. Then there's also the unreviewed topics. So you can vote on a topic that, maybe you've heard about, like the Walls protocol. That's a diet related one. And basically it's an overall healthy diet. But that has 245 votes. So this top one has 1,733 votes. So that would get reviewed next. So if you vote on a topic, then it increases the number of votes and the likelihood that it'll get reviewed sooner rather than later. Okay, switching to tube feeds, when to consider a feeding tube. I know this is a tough decision for a lot of patients. So when you experience excessive weight loss and you're not able to maintain your weight through oral diet, if you've just lost your appetite, if you're unable to drink adequate fluids to stay well hydrated, you can use the feeding tube just to put water through. You can still eat and then just use it for hydration. When eating or drinking leads to frequent coughing or choking, that's a time to consider getting a feeding tube. When it takes more than an hour to eat a meal, that would be a time to consider. Fatigue with meals, when eating is no longer a pleasurable activity. That's another consideration time. And then when your respiratory function is decreasing and risk of aspiration pneumonia is increasing. So if you're thinking about getting a feeding tube, you'd want to get it placed before your FVC gets much below 50%. It still can be placed below 50%, but there's increased risks of, during the procedure. And this is what a feeding tube would look like. Advantages of having a feeding tube: it helps to maintain your weight and increase your energy level by staying, well hydrated and well nourished. Um, it's a safer way to administer medications if you're having difficulty swallowing pills. It decreases the risk of choking when eating, which decreases your risk of pneumonia. It reduces your feeding times. If it's taking you an hour to eat a meal and no longer pleasurable, your tube feed, it would take much less time than that. To reduce fatigue and conserve energy for other activities. You'd still be able to eat whatever you can tolerate and enjoy the foods that you want to enjoy. So eating for pleasure, and then rely on the feeding tube for the majority of your nutrition needs. Some reasons patients may not want a feeding tube is it is a surgical procedure, and that can sound scary to some patients, and they may just not want to do that. There's always a risk of infection as any other surgical procedure, and a risk of possible some discomfort at the insertion site. It doesn't prevent the progression of ALS. It might help you to feel better for the time left, but your ALS will still progress. If respiratory function is too poor, that might be a reason not to get a feeding tube. When the idea of an incision or tube in the abdomen is just an unacceptable thought for you, and when the risks outweigh the benefits. So if your breathing function is really declined, if you have other medical issues going on, if you've had a gastric bypass in the past, it may be difficult to place a tube. And if if the patient has dementia, there's a risk of pulling out the tube. So the risks have to outweigh the benefits. Once a decision is made to have a feeding tube, would place a referral to the GI consult, and then the dietitian in the neuromuscular clinic would calculate your calorie, protein, fluid needs, and develop a feeding plan with your input as far as if you want to still continue to eat, or if you want to get the majority of your calories through the feeding tube, pick an appropriate formula for you, and calculate your fluid and calorie needs. And then the dietitian would coordinate the home delivery of the formula and reassess things, as time progresses. So at each visit, we would reassess, what's changed with your eating, if you're gaining or losing weight, and adjust the feeding plan, and monitor tolerance. Some people have problems with tolerating the formula. Maybe it's more fiber than you're used to eating. So then we could adjust and do a combination of a fiber formula and a non-fiber formula. So I just wanted to go over kind of like the different categories of formula. So a standard formula with or without fiber, there's a couple of them listed there. That's where we usually start. Some patients want formulas with more wholesome ingredients, like less sugar, or so there are some that are still considered standard, and that insurance would pay for. So like Cape Farms or Complete. Some patients are vegetarian and want plant-based formulas, which also would be like Cape Farms or Complete. Some patients really want real food. So there are some blenderized food formulas, which would be like real food blends, which are pouches of meals. So I think they have a variety of 7 different meals now. So it could be like turkey, rice, and carrots, or an egg meal or an oatmeal. So those, they're not supplemented with vitamins. So sometimes you do have to take a multivitamin. They're very low in salt, so you usually have to add salt. They're low in calcium, so you may have to supplement with milk, or take a multivitamin. Then there's Liquid Hope, which is an organic blenderized food formula. It contains grains, vegetables, and nuts. So if you're allergic to nuts, this would not be an appropriate formula for you. And this one is also organic. Insurance usually won't pay for this formula unless you're eating nothing by mouth, you've tried a standard formula and didn't tolerate it, or and also you've tried the Liquid Hope and tolerated it. Then insurance would likely pay for it. There are other specialized formulas for diabetic patients or peptide-based formulas. That would be a formula that's more broken down for easier digestion if there's malabsorption issues. So those are the general categories of tube feed formulas. And then there's different tube feed administration methods. We usually start with the bolus method, which is using a syringe, a 60 ml syringe or 2-ounce syringe. Let's see, and then I'll go into each one a little more detail, but then there's gravity drip bags and then continuous pump feeds. So the bolus feeds are, you use the syringe, like in the picture. You can use the plunger, or you can just pour the formula in without the plunger. And this is usually covered by insurance. And this is more like, like typical eating. You have, 3 or 4 feedings a day, and you have, 1 or 2 cups of formula, at each time. Then there's the gravity drip method, which is also usually covered by insurance. So require having an IV pole, the gravity drip bags. You can kind of control the rate a little bit on this. There's on the bag and the tubing, there's this little roller clamp that you can roll, all the way open for faster or halfway to slow it down. So some people like this gravity drip method because you don't have to hold the syringe and it's easier for the caregiver, or if the patient has difficulty holding the syringe. So this one, can be used for convenience. And like I said, is usually covered by insurance. Then there's the continuous pump feeds, which is similar to gravity drip, but instead of that little roller clamp, the tubing gets threaded through a pump, and the pump is set for a specific rate and a specific number of hours. And it's only covered by insurance if there's a medical need for it, like intolerance for large volumes, that kind of thing. So summarizing, eating a healthy, well-balanced diet with adequate calories, protein, fiber, fluids, vitamins, and minerals is important to stay well-nourished. You modify the diet consistency as needed based on your chewing and swallowing issues. Consider a feeding tube if and when necessary. The goal is to maintain your weight. If you're underweight, obviously gain weight, we mentioned. And staying well nourished can improve the quality of life and prolong survival. These are my references. Any questions?
Thank you so much, Jackie. That was very informative. I appreciate it. I had, so if anyone wants to type in a question, or you can feel free to unmute and speak, but Beth had sent in a comment earlier that I wanted to read for her. She was wondering about one-way straws, learning more about those.
Oh, okay. Yeah, the one-way straws, if you have difficulty sucking up through the straw, the one-way straw, once you suck the fluid up, it stays up in the straw, it doesn't go back down. That can be helpful also if you're experiencing a lot of burping, because sometimes when you use a straw, you inhale a lot of air and then you're burping a lot, or it can cause a lot of gas. So using the one-way straw sometimes helps to decrease that, intake of the air, because the liquid stays up in the straw.
Thank you. And this might be more of a comment than a question, but she had wanted to comment on if you're using a non-invasive ventilator, that you may not need as many calories. She had said that when she started using it, she noticed a weight gain.
Oh, yep. Okay. Yep. So that goes to prove my comment. Yes, that is true. When you go on non-invasive ventilation, it's easier to maintain your weight. Yeah.
Is that because you're not like burning as many calories to try to breathe?
Right. Yes.
Oh,
Yep.
interesting. Um, I had a question I get often that I'm never sure if I'm answering correctly is, if you do get a feeding tube, what is like the guidelines for like swimming or taking a bath or like getting it wet?
Okay. That's more of a question for Angel, but I think I know the answer. Um, as long as the site is healed, I believe you can bathe, swim, all that. Yeah, but it has to be well healed.
Mhm. Oh, thank you. Um, Chrissy, I just written, thank you for the information. Appreciate the resources. Are there any other questions or comments, suggestions from anybody? No? All right. Well, we will wrap up again. We'll post this on our YouTube channel, send out the slides, and if you guys have questions, we can connect you with Jackie or help you ourselves. So thank you again, Jackie, for your time. Thank you guys for attending, and we'll see you next time around.
Thank you.